Regarding the protection of the nosocomial infections, actually, our practice follows the international practice and standards. And also, we have a dedicated team from nosocomial department to really monitoring and also giving the on-site coach to the medics on how to putting on and getting off the PPEs when they getting inside or coming out of the wards. So our hospitals built into the 3 different zones with 2 passageways. So that 3 different zones is the clean zone, the half contained zone, and the full contained zone. For the early morning, let's make the different shifts. So the early shift, the medics right now doing the handwork to the next shift. So they will do everything in the clean zone. And inside the clean zone, of course, we have all the disinfectants to help us clean the floor, and also the all medics required to wear masks. And regarding the semi-contaminated zone, that's the second zone. Actually, it's here where the medics will check from head to toe about their PPEs, and also for the medics wearing the protective suits, that should be also wear all these in the comparatively clean area. And after the work, the medics will take off their protective suits, and we also have dedicated people to teach and monitor the medics to do so. So for the contaminated zone, so the medics need to take off the outer layers, which is 2 layers of their protective suits, and then they enter to the semi-contaminated zone. So at that zone, the medics need to keep their hand hygiene and also wash their face, eyes, nose, and also clean their throat. So regarding the 2 passageways or the 2 elevators, that's also for the pathways for the clean zone as well as the semi-clean zone. So in order to control the infections happened inside the hospitals, a lot of work actually been done by all the medics. And inside the contaminated zone, everything should be subject and strictly follow the international practice and standards. So for the outpatient service, if the patient need to be hospitalized, they first need to do the nucleic acid test, and also their CT scan should also be done. So if the patient with fever, then they need to go to the fever clinic. If the patient with fever is a suspected COVID-19 case, then that patient should be observed right there in the clinical fever clinic. And the patient or the suspected patient with COVID-19, and when they are under the medical observation, they need to do 2 times nucleic acid tests and CT scans and also the antibody test. And if they show 2 negatives to the nucleic acid test, which means they are okay, then they can transfer to the outpatient service. If the patient show the positive test to the nucleic acid test, or their IT scan is actually in line with the confirmed cases, then these patients need to be transferred to the designated hospital. And also we talk about for their close contacts or their family members, in order to lower the possibility of infections among family members, we also have the requirement. So we encourage the family members, especially for the COVID-19 severe patients, their family members need to conduct field visits, and also we help them to do the video chats.
Thank you. 谢谢王主任. So thank you.